is an advocacy platform aimed at eliminating African nutritional challenges and opportunities, transformative ideas, and game-changing solutions through continuous conversations, call to action, advocacy support, and engagement to curb malnutrition in Africa. Our aim is to solve the large gap in awareness and knowledge on nutrition matters on the continent. Through policy, advocacy, and media to bridge this gap and drive multifaceted engagement for our audiences. To put our discussion into context, I'm pleased to introduce and welcome Grace Tuo, Communications Manager, Country Programs at GAIN. Grace, are you with us?
I am. Thank you so much, Wendy, and everyone who's been able to join with us today. Welcome. And as we begin this, put some of this into context for our audiences. According to the World Health Organization, Africa has the world's highest per capita incidences of foodborne disease. It claims about 137,000 lives a year, which causes a million cases of sickness. So these are big figures, which we have to wrap our heads around. So improving food safety is a global challenge, and there's a general lack of awareness to food vendors and to consumers. But even so, we have a lot of innovative solutions that are being developed every day to make food safer around the world. So how do we ensure all segments of the value chain are aware of these solutions and are applying them, specifically in traditional food markets in Africa? And today we are excited to bring together food safety experts across the country, working towards providing these solutions and solving these issues across Africa. And so we encourage active audience participation. Add your comments, your questions, your thoughts, and box. We will have a session and an opportunity to address as many as we can the discussion. So at this point, to begin the program, I will pass on and please introduce to you Halima Dabana, who is a colleague for Nutrition Conversations Africa. So over to you, Halima, take us through the panel session.
All right, thank you very much, Ms. Tuo. So my name is Halima Dabana, and to all our guests and participants, welcome to this edition of Nutrition Conversations Africa. So as mentioned earlier, in today's session, we would be discussing food safety in Africa, sustainable solutions and strategies. Joining us are 4 distinguished panelists. As we work our way through the session, please put any questions you might have in the Q&A box. So I would like to begin today's discussion with Ms. Jacqueline Hanali Njonjo, the Africa lead for the Food Safety Program at IFC. Ms. Jacqueline, can you hear us?
Yes, I can hear Halima. Good morning.
All right, good morning. So she's a food safety expert with over 20 years experience in the industry, working in the horticulture sector in Africa and the UK. Based in Nairobi, Kenya, she's an advocate for food system strengthening with an excellent record of delivering solutions that integrate food safety management systems in primary production, from small outgrowers to large-scale farmers, as well as food processing sites, with a strong retailer understanding and experience. So, Ms. Njonjo, it's a pleasure to have you here with us this morning.
It's a pleasure to be here, Halima. Thank you so much for the invitation.
All right, thank you for honoring the invitation. So let's get right into it. In your work at IFC, what are some of the common misconceptions you face with regards to food safety in Africa?
Halima, thanks for that question. As a lead for the food safety project in Africa, we come across a lot of misconceptions. I think the biggest one that we find is the fact that there's always this concern, particularly from the developed world, that the African region or the African countries do not necessarily have the capacity. They don't have the resource in terms of human resource. They don't have the resource around ensuring that we've got food safety experts who can support food safety initiatives within Africa. So we find that those are some misconceptions. To some extent, there is some gaps, but I don't necessarily think that is completely and entirely true. The second thing I think is concerns around the fact that when you talk to a client in the developed world, they always think that implementing a food safety management system or any food safety systems within Africa is an impossible or almost a difficult task. Now, with our experience at IFC, we found that that is not the case at all. And we've worked with nearly 59 entities across Africa, and we've been able to implement food safety management systems across the complete value chain, from the really small farmer to the logistics companies, to food processors, to food manufacturers, retailers, as well as hotels. So for me, when I look at Africa, I find that sometimes there is misconceptions around the fact that we may not have the capabilities, or we may not have the necessary resource to make food safety an important agenda. But I think, and based on the knowledge and experience I've had in Africa, that is definitely not the case. Thanks, Halima.
Well, thanks, Ms. Njonjo. So they believe that we are not capable enough to implement systems, but you believe that we are, and we can do it. All right. So thank you very much.
I know that we can't, that we are able to, and we have been able to. So that is not the case whatsoever.
Okay, thank you very much. So to build on this conversation, I would like to introduce Dr. Augustine Okorowa, the head of Eat Safe Country Programs at the Global Alliance for Improved Nutrition, GAIN. Good morning, Dr. Augustine.
Good morning. Yeah.
Hey, good morning. It's nice to have you here with us. Dr. Augustine has over 30 years experience in food quality, post-harvest technologies, food products research and development in both the private and public sectors. He has vast experience in good manufacturing practices, quality assurance, food safety and hygiene, and regulatory affairs management, working with a range of organizations. He successfully led the implementation of GAIN's initiative on reducing post-harvest losses in key nutritious commodities and value chains. He is currently leading the implementation of the food safety program at GAIN, aimed at enabling lasting improvements in the safety of nutritious foods in traditional or informal markets by focusing on the consumer. So good morning once again, Dr. Augustine. We're really glad to have you here with us. So to start us off, what is food safety? Can you provide a detailed explanation on food safety, the purpose of food safety as an area of interest for consumers, especially related to the traditional markets? And what solutions has the Eat Safe project provided to the issues of food safety in Africa?
Yeah, thank you very much. Just for the basics, food safety is the assurance that food will not cause any harm to the consumer when it is prepared and consumed as intended. Now, the purpose of food safety is because of the importance as a public health issue. Globally, over 600 million illnesses and over 420 premature deaths occur as a result of consumption of unsafe food. In that number, 91 million people in Africa fall ill each year, according to the World Health Organization 2015, which also represent 1/3 of the 400,000 global deaths from foodborne diseases. Although Africa, is just accounting for about 16% of the world population. And that is very significant. And unsafe food also costs the low and medium income groups a large amount of money, over $110 billion from productivity loss, medical expenses. And this is mostly in sub-Saharan Africa, South America, and the Southeast Asia. In Nigeria, for example, over 200,000 deaths annually from consuming unsafe food, and we have over 173 million cases of diarrhea and about 33,000 deaths. So you can see that the food safety is very critical for sustainable livelihood, very, very critical. And it is a requirement for access to regional, national, global food markets. And now that we have the Africa Continental Trade Area Agreement, it's contingent that success will be based on assuring food safety in the trade, locally, regionally, and internationally. And it's also very important for the accomplishment of the Malabo Declaration on ending hunger, tripling intra-Africa trade, and having poverty. So with this, that is why it's critical. And all of us on this call, on this webinar, all of us are consumers. And that is why Eat Safe, Evidence and Action Towards Safe and Nutritious Food, is focusing on traditional markets, where a significant number of households in Nigeria and in low, medium, and income countries actually purchase the food that they eat in their homes. Thank you.
All right, thank you very much, Dr. Augustine. So back to you, Ms. Njonjo. What are some of the recent emergent challenges to food safety, and what are the strategies for improved food safety conditions?
I think, Halima, one that comes to mind really quite fundamental, quite important, and we cannot ignore it because of the fact that we are seeing, I think, the back end of it, and we hope we are seeing the back end of it, and that's really COVID. And I think from my experience, we've noted that COVID has impacted a lot of the African countries, quite negatively, especially around food security. And the fact that because of some of the restrictions that had to be put in place to manage the pandemic, we had issues around logistics, just getting product to market, and concerns around access of that product by some of the consumers. So for us, for me, I think COVID has been huge in terms of impacting food safety in the most recent years. But with regards to challenges and what we've picked up as an entity, we've noted that as we went around talking to some of our clients around the impact of COVID on their business, we had a lot of mixed experiences. But I think one that was quite profound for us was that whenever we talked to businesses or clients that we'd worked with and had already put food safety management systems in place, they came back and noted that the fact that because they had food safety management systems in place, when it came to actually operationalizing some of the mitigation procedures and guidance that had been put in place for COVID control, for example, washing of hands and putting masks or masking, as they call it, they found that quite seamless. They realized that it did not take them a lot of time to sort of go back and educate people around why that was important, because part and parcel of implementing a robust food safety management system is ensuring that you do maintain some high levels of hygiene. And so for us, we note, yes, it has been challenging. There are a lot of businesses that have closed. A lot of businesses have are basically not trading because of COVID. However, those that have been able to stay in business and have been able to be sustainable and resilient have noted that having a robust food safety management system goes a long way around ensuring that you can actually accommodate all the changes that need to be put in place to ensure that you are trading and manufacturing the food, not just in a safe way, but in line with the COVID restrictions. Thank you, Halima.
Very insightful. Thank you very much once again, Mr. Njonjo. So for our next question, I would like to introduce Mrs. Jane Omojokun, the Managing Director and Lead Consultant at Nugata Consults Limited. Ms. Jane, can you hear us?
Yes, I can. Thank you, Halima.
All right, thank you. Good morning. So
Good
Mrs.
morning.
Jane Omojokun has several years' experience in the food safety industry. She was the head of regulatory affairs, food safety, and codex divisions at various periods in time at NAFDAC, which is the National Agency for Food and Drug Administration and Control. She was the World Health Organization International Food Safety Authorities Network Focal Point Officer for Nigeria and a member of the International Health Regulations National Committee, providing the periodic review of Core Capacity 11 on food safety. She is also a member of the National Institute of Food Science and Technology. So good morning once again, Ms. Omojokun. Thank you so much for joining us today.
Thank you, Halima.
What are the challenges you encounter as a food safety consultant in ensuring that the products offered to consumers are safe for consumption?
I would say the main challenge is that the food systems need to be strengthened, because you find out that, of course, we know the food systems involve the processes connected with production, with food production, and food utilization. So, and that has to do with the growing, the harvesting, packing, processing, transportation, and marketing of food. So there's actually the need to strengthen the food systems, which cuts across these value chains. Everybody that is on the value chain needs to know their roles and needs to be familiar with the appropriate food safety management system for them. If you're on the farm, you should know the GAP, if you're processing, GHP, and things like that. And another challenge is that there's inadequate cohesion, of the activities of the regulators and all the other bodies, regulators that have a role in food safety. So the activities actually need to be coordinated. Like we're talking about the open market. It is the local government area that oversees food safety in the open market. So there's a need for coordination at the 3 tiers, the federal level, the state level, and the local government level. Everybody should play a role. And of course, those at the local government area levels are not really equipped because they lack the adequate knowledge and the skills to be able to implement food safety in the marketplace. So it's important that all these bodies that have a role to play at these three levels coordinate their activities and make sure that food is safe by the time it gets to the consumer. And another thing is that those that have roles to play don't really appreciate the significance, the importance of the roles they have to play. You find out that some people play those roles because it's demanded by the regulatory bodies, so they just don't want any sanctions, but they need to appreciate. And I think there needs to be a resetting of people's mindset. They should begin to see their roles not only because it's a commercial thing and they want to make money, but because they have a significant role to play. So those are the challenges you find, and you find out that the consumer too is not making as much demands as it should. The consumer demands are not really very high. They just accept whatever that is given to them. So all this poses some challenges because there's the need for a lot of coordination, awareness, and things like that. And for everybody to realize that food safety is actually everyone's. Thank you.
Food safety is everyone's business. Thank you very much, Mrs. Jane. Okay, so I'll be introducing the next panelist. So we would have Professor Adewale Obadino, a professor of food safety and biotechnology at the Federal University of Agriculture, Abeokuta. He's standing in for Professor Olugbenga Ogunmoyola, the Executive Director of Capstani. Professor Obadino, are you here with us this morning?
Like I mentioned earlier, I'm standing in for him. I'm blessing on him. I'm standing in for Professor Obadino.
Oh, okay.
Yeah,
all right. Okay, so the first question is, as an expert in food safety and nutrition initiative aspects, what are the priority areas to be focused on as regards food safety for food products?
Yes, thank you very much for that question. One of the things that we've done and that are key priority areas for us is the issue of poor manufacturing practices. We have many people who are in the food value chain that do not know anything about food safety. They don't even know anything about nutrition, nothing about food safety. So they are just in the value chain all because of business. Oh, I saw this, that is a basic amenity. So I also want to just fit in to ensure that I play a role. So the challenge is there. Poor agricultural practices is also there. Poor hygiene. If you go to many places, even in the informal markets, you see a lot of dump sites of fruits and vegetables that are bad, wasted foods. You see poor infrastructure in the markets, no availability of cleaning materials or cleaning infrastructure. Then we also have the issue of poor market layout, such that even if you have any goods, you have any food wares, there are no structures, there are no layout for market regulation, no layout for market structure. So these are key priority areas that has been affecting our food safety. Then we also have the issue of logistics, people that are into the supply chain. And of course, we have improper carriage. We have seen pictures, we have seen activities of people who put their meat on motorcycles. They put their food on improper, unwashed containers and all that. So these are things that is really affecting. Then we also have the issue of food fraud and adulteration. We see people who are misrepresenting foods, calling foods which they are not, putting inappropriate chemicals, inappropriate ingredients into the food, so that the consumers are deceived. They say and of course, when they are doing the labeling, they also include that, oh, this food is safe, this food has this content and all that. So these are things that has continued to be key issues for us as Capstani. And of course, lastly, we have the issue of regulatory system. People see regulators as how will I put it now, as enemies. They don't see them as co-partners in ensuring safe food. They see them as enemies. When they come, they always want to just run away so that their foods are not inspected and all that. So these are key priority areas for us when it comes to issue of food safety in Africa. Thank you very much.
All right, thank you very much, Mr. Blessing. So for the next question, we'll be going back to you, Mrs. Jane. What would you say are some ways to ensure compliance of companies such as SMEs in terms of food safety?
Thank you, Halima. I think the first thing will be technical guidance. Guidance goes beyond the training. You can train people, but they still need the guidance. Okay, for instance, if you now want to register a product with NAFTA and you engage us as consultants, the process, documentation, inspection, lab analysis, and the product approval meeting is a process. And you'd expect that's what you need to do. But within each process, there's a lot to be done. So the client, the SME, actually needs proper guidance, and we try to do that. For documentation, while you guide them on documentation, it's an opportunity to tell them about the regulations, like that guide what they do, and to tell them about the importance of what they do. You help them set up their flow, and as you're helping them set up, you're explaining to them why it has to flow the way you have set it up. So there's no back and forth movement as they produce that will lead to contamination, cross-contamination. So that's what I mean by when I say guidance. And of course, you tell them the implications of the activities of personnel, why they need to do things hygienically, which is the GHP. So beyond training, the technical guidance, like I've used this example of product registration explain. So when we do that, we don't just go through these processes, bring your document, let's check with NAFDAC. We try to include guidance so that in doing those things, they understand that NAFDAC, the Kapsani speaker had talked about SMEs, seeing the regulators as policemen, you're frightened of the police. When you have an issue with them, you're just like really scared. So when those they're coming to inspect, understand why they ask them the questions they ask, why they want them to do things in certain ways. They're more relaxed. They know what to do. They can answer the questions without being nervous or trying to escape regulatory activity. So technical guidance, I think, is very, very key. So wherever food safety is being implemented at whatever level, there needs to be guidance in addition to training, which I've mentioned. Training, you cannot overemphasize that. It's a regulatory requirement. People need to be trained to understand why they do what they do. Of course, if you can put in mentoring and coaching, because mentoring and coaching is a more relaxed atmosphere. It's like seeing what people do, correcting them as they do it, and building them up. So SMEs actually need a lot of building up their confidence. And they say knowledge is power. When you do all these things, they're more confident. They're not nervous. They don't want to run away from the regulators, because they're even wanting an opportunity to show off, to tell to show the regulator how much they're on top of their game. Then, of course, enforcing the regulations, regulatory requirements will help. If you have all these regulations and you don't enforce it, people won't really take it seriously. And enforcement includes training and making sure that whatever the regulation says, their guidance for how you produce and what it is enforced. Thank you.
Thank you once again, Mrs. Jane. So Mr. Blessing Oni, will be going back to you.
Okay.
What solutions can be advocated by organizations, bodies, or agencies to curb the issues surrounding food safety in Africa?
One thing, thank you. Just like Mrs. Jane Omojoko said, the issue of sensitization is very, very paramount. And to all of us, we are all consumers. What happens at the markets, we are all involved. So we need to do proper sensitization for everybody. Everybody needs to know what is food safety. If there is no knowledge, then of course there will be no demand. Just like she mentioned earlier, that there is no consumer demand. And that's what we have also seen from our own perspective as consumer advocates, that the consumers are not, they don't even know what is their right. They don't know they have the right to save food, so they are not even demanding. And once there is no demand, once there is no knowledge, there can be a demand-driven effort. And it's this demand-driven effort that will ensure that everybody in the value chain does what is necessary. A supplier knows that the consumer will be asking, is this food safe? The manufacturer will be asking, will be involved. The farmer will know that there are demands. So these are things that is very essential. We also need to create awareness, different guidelines that will enhance food safety, even at the household level, like the WHO guideline for food safety, for preparation of food. We have that. So these are things that should be incorporated into different awareness platforms to ensure that people practice food safety. Then, of course, another thing we need to look at is the deployment of technologies. We have different kind of technologies now that can enhance food safety. We have the cold chain technology that ensures that the temperature is kept at a level that is inhabitable for microorganisms across the value chain. Then we also have the sensor, the sensor technology. It's well not a complex technology, but it's a very good technology that if it's deployed, it will ensure that safe foods are monitored. Is a real-time assessment on the value chain, such that any food that is unsafe, there is a signal, there is a sensor that triggers, that sends an information to the database to indicate that this food is not safe. Then we have the thermal energy, the thermal technology rather. We have thermal technology that also enhances food safety. We have improved detailing and the packaging technology that can also ensure that we have food safety. Then we have different implementation guidelines, like the GMP, the SOP, the HCCP, the GHP, ISO, and all those guidelines that is necessary for all food manufacturers to imbibe, to see that they go through the training, they go through the certification process to ensure that the foods that have been prepared from their food centers are well safe. Then we also have training for SMEs. We've discovered over the years that many of these SMEs, they don't know anything. Like I said earlier, they don't have any knowledge. So there is need for training and retraining, even at all levels. There is need for training and retraining to ensure that food SMEs are safe. Then, of course, you have the installation of proper hygiene equipment. Is it personal? Is it at the food center? There is need for proper personal equipment. We also need to ensure that the gatekeepers, that the market leaders, the markets, they are all well informed about what food safety is, so that, because these are opinion leaders, these are people that people hear from time to time. If gate marketers give an instruction, if the market leaders give an instruction, it is expected that their followers will do this. So they need to be informed, proper information for them. Then we also need to ensure that the government comes on board to ensure that proper market structure and infrastructure are deployed to the market to ensure that our foods are safe. There are cleaning facilities at the market, there are proper toilets, there are sanitation centers and all that. Then the environmental officers need to also be deployed. They need to be strengthened. The establishing acts for the environmental units needs to be strengthened so that they can carry out their functions as expected. Then conclusively, I'll be talking about strict laws and policies. There is need for us to have laws that are governing a market guiding the value chain so that the foods are always ensured to be saved. Thank you very much.
All right. Thank you so much, Mr. Oni. Okay, so back to you now, Dr. Augustine. So can you please tell us some specific solutions that the Eat Safe project has provided to the issues of food safety in Africa?
Yeah, thank you very much. As you may know, Eat Safe is an ongoing project. It's a 5-year project funded by the United States Agency for International Development. And because of the COVID-19, we only really started in the field in 2020, and the project is focused at traditional markets in Kebbi and Sokoto states. At the moment, the project has completed phase 1, and that phase 1 involved formative research. And from the formative research, we have developed, provided information on how consumers, vendors, and actors think about food safety, and we've shared that in the public media through webinars, participation in conferences, and so forth and so on. But the key elements of the solution that will come through Eat Safe will be the outcomes of the implementation of intervention that we have designed, having identified gaps in the markets, traditional markets. And in collaboration with the stakeholders, we have looked at interventions that include the following, which we are currently pre-testing in the market in Kebbi, that's Benin Kebbi, and Sokoto. One of them is a radio show. Just like Mr. Oni said, sensitization awareness. We are convening a food safety radio show that will involve information on food safety being broadcasted to the generality of the population in the 2 states, from the basic of food safety to the understanding that consumers have a right to safe food, so that they can also understand and be able to access safe food in traditional markets when they get there. The second intervention we are testing, which will be fully implemented also, is the clean food or food safety stand in the marketplace, whereby patrons or people patronizing the market, when they come into the market, they will have a stand they can go to and ask for information on food safety. And we have a qualified person there that will be standing there, providing relevant information through verbal communication, through pamphlets, through descriptive information, banners that will provide information on key messaging on food safety. And that will help both the vendors, the consumers, and all actors in the entire value chain as they come in contact and they come to do their business in the market. We also have an intervention that we've targeted as Food Safety Compliance Recognition Award for vendors. After they have been trained, because we're doing a major training, and interestingly, Kasani has been selected to conduct that training for consumers, vendors, and the stand staff, and all of the actors. And then, once they have been trained, there will be a form of recognition given when their behavior, because the project wants to ensure some behavior changes in the vendors.
So let's move on to you, Ms. Njonjo. Africa is advancing towards a free trade zone. Do you think the continent would be biting off more than it can chew to ensure food safety compliance?
Halima, I think it's an opportunity for discussion. It's an opportunity for the African continent to sit down and start the discussions around, strengthening food safety, like Dr. Jane just mentioned. This is an opportunity for different governments and different regions to sit down and collaborate around streamlining SPS activities and regulations to ensure that there's free trade. We need discussions and we need agreements around how do we build capacity, for example, around border trade. I mean, that's a big issue. If we're going to have free trade, there's a lot of discussions that need to go around harmonizing things like tariffs, because there's various different tariffs, East Africa, West Africa, North Africa, they are not harmonized standards as well as the rules of origin. So for it to work, we need to ensure that there's more discussions around food safety and how to manage food safety within the African region to ensure that as we do this free trade and there's more opportunity, there's no more food being moved around the region, that we have standards and systems that actually work. And so for that reason, I wouldn't say that we are biting too much. I don't think so. I think it's just an opportunity for us to sit down and really seriously engage on putting systems in place that ensure that we can actually trade. And when we're trading, we're actually trading safe food within the region. So there's a lot of initiatives that have been done within different regions and different organizations and different countries. So I think this is going to give us an opportunity, all of us, to sit down and harmonize those and start talking to what works best, talk to each other about best practices, and work together to make this happen, because it's a brilliant initiative, and it's an initiative that we should not assume cannot work. I think it can work, but it just means that it just needs us to sit down and start talking together as a region to make it work. Thank you, Halima.
All right, thank you very much, Ms. Jacqueline. So Mrs. Jane, are there any trainings available for SMEs to meet the needs and relevance of food safety to good health? Do you have any recommendations?
Sorry, thank you, Halima. I'd like to recommend that there's training all along the food chain, because if you have an unsafe raw material or fresh product, you can never have a safe finished product, So the training should actually start with GAP, so that those on the farm will know how to produce safe products, because it moves there. Either it's sold fresh or it's processed, whichever way, whatever thing, the safety starts there. They should know what to use, the inputs in terms of the agrochemicals or whatever. Now, agrochemicals are actually discouraged, even globally. People are trying to produce, to do inorganic farming, which is better, because that's what the consumer is demanding too. The consumer wants less of use of chemicals. So I would recommend GAP. I would also recommend GHP, good hygienic practices. With the hygienic practices, it's not just the personal hygiene. It covers the environment, how wherever you're doing your business is, even on the farm, the environment. You're not expected to site your farm where there'll be a lot of pollution, like beside the chemical factory, for instance, because you can't control pollution of the soil if you're too close to such a facility. So GAP will teach you all that. That's GAP. Then GHP will teach you about the environment, handling, even packaging, because everything should be done hygienically. If you don't do things hygienically, you can't deliver a safe product. So I would say GAP, GHP, then risk-based food safety management systems. Even globally, with global GAP, there's even there's a version 6 of the global GAP IFA, that's Integrated Farm Assurance Standard. And what the version 6 has tried to do is to simplify all the processes that will ensure you're producing safely right from the farm. Like I talked about the farm being quite critical, because that's the starting point. So with this one is risk-based, unlike what they had before that was kind of prescriptive. This one is not prescriptive. Whatever thing you are doing, you analyze the risk and you focus on preventing hazards that will lead to that risk. So I would say risk-based food safety management system. Of course, food safety management systems covers everything that will make the food safe: HACCP, traceability, GHP, GAP, like I've said, if you process, GMP. So I would advocate training on such things. Of course, packaging has become very, very important, especially it has always been important, but now the way things are moving, where there's a lot of e-commerce, packaging is very, very important, because there are regulations guiding it, like the date markings and what have you. Then, if you package, if you try to be innovative and you package and you put a QR code where you talk about how you process to get to your product, it sells. It gives you better market access because people want to scan the QR code and see that, oh, for instance, this company, it's a women initiative. You know, people are concerned globally about women, empowering women and the youth. So if they see it's maybe a women cooperative company, and that one shows in your QR code, it shows you are not using child labor and stuff like that, then your product sells. It will access the international market better because that's what they're looking for. It may not be very important to us in Africa because we see children as well. You have to help your parents to survive because there's a lot of struggle for survival. But globally, if SMEs want to set up practices and scale up and get into exports, all those things are important. So I feel that packaging is important and can get innovative and add all these things. So training in all those areas, I think would be useful to start because, you know, they say catch them young. So if you start, and to me, catching them young is like with the SMEs, when they're still growing. They imbibe all this, they're trained and they imbibe all these values and assuring food safety. And when they get bigger, it's better. Thank you.
Thank you so much, Mrs. Jane. All right, Dr. Augustine, are you back with us now?
Yeah, I'm back. Sorry for the internet glitch.
All right, no problem about that. So I would like to ask you about the ongoing Eat Safe Innovation Challenge. Can you tell us a little about it, just briefly?
Yeah, this innovation challenge, Eat Safe Innovation Challenge, is a collaboration with the Sun Business Network. And we're looking at solutions that will transform food safety, especially businesses, research institutes, students that are the challenge to develop processes across different systems, processing, different aspects of the value chain transformation, so that at the end, we're able to get solutions that can support the delivery of safe, nutritious food. That is the basic of the challenge. Whatever challenge solution that emanates from this safe innovation challenge is meant to drive the consciousness, the access, the availability of safe food in the marketplace. So there will be a selection process. Applications will be received and they will be evaluated against set criteria. After they have been evaluated, these pitchings will be done. And at the end of it all, we have finalists selected. This particular innovation challenge is currently being teamed for Nigeria and Ethiopia, where we have the Eat Safe project currently running. So it's aimed to stimulate, among others, the need to focus urgently on ensuring that we have access to safe, nutritious foods using technologies that are currently being developed or will be developed or will be applied or will be adapted to ensure that we have access to safe, nutritious foods in the marketplace.
All right, thank you. So how do we apply for the challenge?
Yeah, there is a link that has been shared. We've actually shared with several stakeholders in the public space, in social media. They have been shared on LinkedIn, shared through email, and the links have been forwarded. So we have received several applications already as the date closes out very shortly. Thank you.
All right, thank you. So audience members, check out the GAIN and SBN social media pages for the link to apply. So I would like to thank all the panelists for your insights and your perspectives. Thank you for speaking with us today. So I would let Aderonke Alabi, the NCAfrica co-lead, go over from here as we transition into the question and answer session.
All right, thank you, Halima. Thank you to our wonderful and distinguished panelists for the insightful and impactful conversations as regards the food safety in Africa. So now we'll move into the question and answer session. My first question goes to Ms. Njonjo. Please, can you provide guidelines that are related to the WHO that can be used or implemented by farmers or marketers as regards food safety measures in Africa? Thank you. The floor is open to you, Ms. Njonjo.
Yes, thank you, Halima, for that question. I would like to draw your attention to our website. I mean, we have at IFC developed a lot of publications that support food safety across the value chain, and that's from good agricultural practice on primary production all the way to retail, as well as hotels and restaurants. So the website is www.ifc.org/food safety. Please visit this particular site because there's a lot of information there. There's a lot of guidelines around coaching and mentoring. There's a lot of guidelines around how to implement a food safety management system, not just for primary production, but all the way through manufacturing, as well as retail and hospitality. So I encourage all of you to visit that website. I think it will be extremely resourceful for anybody who's looking for some information around food safety management, especially in Africa. Thank you.
All right, thank you, Ms. Njonjo. Thank you so much. All right, then does Dr. Augustine want to add to the contributions of Ms. Njonjo? Do you have any contributions to add, sir?
Yes, there are several guidelines for food safety from the farm to the table, or from the farm to the fork. Yeah, the good agricultural practices is a guideline that cuts across. And for WHO, we have the 5 keys to food safety, and they have developed several guidelines. Then the Food and Agricultural Organization have also developed guidelines, even for food control systems in countries. And the Codex Alimentarius Commission also provide guidelines on food safety that can be adopted in countries relative to their context. And then we also have the Nigerian government. We have a food safety policy document that is currently being revised, and then the food safety and quality bill that is also with the National Assembly.
Okay, thank you so much, Dr. Augustine. Thank you. So my next question goes to Mr. Blessing. I'd like you to give us some maybe regulations or measures that can aid the compliance of farmers and marketers to curbing food adulteration and food fraud.
Thank you very much.
As regards, you're welcome. The floor is open to you.
All right, okay. One thing that farmers should know is that they are consumers as well.
Okay.
So if that mindset is there already, marketers, farmers, manufacturers, if that mindset is there that we are all consumers, I'm sure that's the first key victory or success, as it were, to ensuring curbing food fraud or food adulteration.
Okay.
For instance, there is an adage in this part of the country that says that if you throw a stone into the market, if it does not meet your neighbor, it will meet your family member. So if you are producing a food that is on or if there is a if your food is misinterpreted, of course it could be your neighbor, it could be your family member that will buy that same product and will take it home. And of course, we have seen different incidences of foodborne illnesses, food deaths, and all that. So that's the first thing that we need to know. Then the issue of regulation is NAFDAC has been doing a lot of advocacy activities, a lot of advocacy work, including SON, to ensure that food adulteration is being wiped out. But without the consciousness of people knowing that they have to abide not only just in place of regulation, but they have to do what is right. Doing what is right is important. Doing what is right at all times by everybody is what we should and that's what we have continually engaged. We are continually advocating for at CAFSANI, that there should be the issue of food fraud should be eliminated in any form that it is. It could be in the open market, anywhere it is. There should be that consciousness. So there are regulations like SN has a regulation, NAFDAC has a regulation, the Federal Ministry of Agriculture has different regulations and all that. But if we all have that consciousness, then I'm very sure that we're able to overcome the issue of food fraud and food adulteration.
All right, thank you for that contribution, Mr. Blessing. Thank you so much. So I'd like to direct this to Mrs. Jane. Please, we need you to go over the training website once again, ma, and where they can be found. Thank you, ma.
You know, there's a lot of training materials, I'll put it that way, training materials, because training is conducted at various levels. It could be the international one, like Global Gap has its websites where you can get training on GAP. Of course, you pay for it and get trained, and you choose whatever you want to be trained on. So there's the Global Gap website, just type www.globalgap. It will come up and you see the training. It's a window. It will come up if you just say training. Then of course there's you know, when you talk about training, I like to see it as those that can train, maybe the experience they've had, not necessarily the website for training, but the website for getting materials to train. So you equip yourself, like if you're a food safety expert, you can do food safety training. You go to those sites that they have mentioned and you structure a training, a bespoke training. It depends on who you're training, what they want, the level they have, because you have to bring the training down to their level. The language you use for an SME is not the same you use for a big manufacturer. It's at different levels, but the bottom line is that you want them to do things. The language you use in the open market, which is where we're focusing, is not the same language you use. So when you talk about the training website, for instance, those in the open market are not that enlightened, you know, they're not going to search the internet. So I like to see it as those that can offer them those training that will be impactful, that will give the results we're looking for. Like you have Kasani, you have Lugata, we all train. So it's to identify, and you can check us up on our websites and decide those that can train and use. So I would rather want to look at it as those that can offer training that will address the situation in Africa, you know, with the SMEs. And of course, those ones would know the sites to get the training, the resources to train. Thank you.
All right, thank you, ma. Thank you, Ms. Jane, for that, Mrs. Jane, for that. So thank you to all our panelists. Due to time constraints, we are unable to entertain further questions. So this will be the end of the question and answer session. So once again, on behalf of Gain and Wandiview, we thank the panelists and the participants for joining this engaging session today. And we hope that the solutions discussed today will be carried forward by policymakers, businesses, the consumers, and all stakeholders in this nutrition space. And we hope this is the beginning of continuous conversations, call to action.
Last word from my end. Just a last word from my end, just to let you know that it's a project. It's a project is registering the Association for Promotion of Food Safety and Improved Nutrition with the Corporate Affairs Commission as an umbrella body for promoting food safety in Nigeria. That is part of the solution that It's Safe will be promoting once it is fully registered with the Corporate Affairs Commission. Thank you very much.
All right, thank you so much, Dr. Augustine. So in conclusion, we'd like to end this session and thank our wonderful panelists for the insightful and impactful conversation. And once again, on behalf of Gain and Wandiview, we thank you all and the participants for joining this engaging session. And we hope that the solutions that we've discussed today will be carried forward by policymakers, businesses, consumers, and then the stakeholders in this nutrition space. And also, we hope that this is the beginning of continuous conversations and call to actions involving the solutions and strategies to the issues of food safety in Africa. Thank you to our wonderful panelists. Thank you so much for your time. Thank you, panel participants, for joining in. We have now come to the end of the webinar session. Do have a great day. Thank you.
Thank you.
Thanks, everyone. Thanks.
You know your questions as well. We'll answer them and send them to the panelists. Thank you so much.
Yeah, that's for all of us. Thank you.
Thank you.
Thank
Thank you, everyone.
Yeah.
You're welcome, Ma.
Okay. Yeah.